The size-wise Bari-Rehab Platform2, otherwise known as the BRP2, is the ideal bed for all levels of care for the bariatric patient. Built and designed to look like a standard hospital bed, the BRP2 aids care providers in the patient rehabilitation and ambulation, and allows patients to be an active participant in the recovery process. The BRP2 accommodates a safe working load up to 1,000 pounds and features an open architecture, flat surface deck, allowing facilities to use a variety of therapeutic support surface options on the bed, accommodating patients' needs throughout the course of their stay. The industry-leading bariatric bed deck low of 15.75 inches makes the Bari-Rehab Platform2 ideal for ambulating patients off the side of the bed, preparing them to move on in the continuum of care or for return to their home. The 30-inch deck height of the BRP2 allows care providers of all height ranges to adjust the safe ergonomic working height of the bed to best fit their needs when providing patient care or assisting with ambulation. Lateral transfers between the BRP2 to an operating room table or other piece of equipment are easily accommodated with the bed's deck height. The BRP2's sleep deck is 39 inches wide, expandable to 48 inches wide by 80 inches long. An extra long version of the BRP2 featuring an 86-inch long sleep deck is available to accommodate taller patients. For those patients that need a wider sleep deck surface, the BRP2 is equipped with 4 expandable sections on each side of the top deck. To expand the width of the bed, slide the locking knob to the unlock position and pull the deck out. To lock the expanded deck section in place, release the locking knob in the lock position. This will be required on all sections of the top deck to reach a full 48-inch expansion. 48-inch sleep deck surfaces are available for use on the bed when it is expanded. To return the deck to 39-inch width, slide the locking knob to the unlock position and push the deck back into place, releasing the locking knob back into the lock position. The headboard on the BRP2 is removable to provide unobstructed access to patients' airway as well as for code situations. The footboard is removable in the same manner, providing the care provider unobstructed access for treatment on a patient's lower extremities. The BRP2 is equipped with dual caster wheels, making transport in and out of elevators, over thresholds, and throughout the facility less cumbersome, reducing the risk of injury to care provider. One-step lock and steer casters are located at the head of the bed as indicated by the green pedal. One-step brake casters are located at the foot end as indicated with the red pedal. Prior to operating the bed, ensure that both the steer and brake casters are in the locked position. Using the 8-button hand control pennant, the care provider can raise or lower the head section of the BRP2, raise or lower the height of the bed, gatch or lower the knees, or place the bed in Trendelenburg or Reverse Trendelenburg. All size-wise hand control pennants are consistently designed to make transitioning between products as seamless as possible for care providers. The control pennant features a clip on the back to allow it to be hung on any of the bed's rails, making it easily accessible for care providers as well as patients. The hand control pennant is designed for not only care provider use, but also for the patient to have the ability to reposition their bed should the care provider allow. Rather than being built into the side rail where a patient may have trouble reaching or turning to operate bed controls, the BRP2 pennant can be placed directly in bed with the patient or hung on the inside of the side rail for easy access. Additionally, the hand control pennant glows in the dark, making it easy for patients to see the control pennant and care providers to find when entering a patient's dark room. Using the instructions found on the back of the hand control pennant, care providers can place the patient into a cardiac chair position, helping them achieve one of the first steps to mobilizing a patient in the critical care environment. The cardiac chair position also allows patients to sit up in bed for meals, to watch TV, visit with guests, and achieve general overall comfort. Using the hand control pennant, which is designed to allow the user to operate more than one button at a time, press and hold the head up and knee gatch buttons at the same time. The bed will gradually reposition the patient, allowing the care provider time to move any tubing or cords out of the way that may be attached to the patient, check patient stats as the repositioning occurs, and allow the patient to adjust to the new position. Once the patient's head is up and knees are gatched, place the bed into reverse Trendelenburg to achieve desired angle. To take the patient out of the cardiac chair position, press and hold the knee, head, and bed down buttons at the same time to gradually return the patient to a flat position. To assist care providers in treating respiratory patients and for the prevention of ventilator-acquired pneumonia, head angle indicators are built into the head rails. This helps care providers ensure at least a 30-degree head angle or the prescribed angle for the patient's condition is achieved. Like the head and footboard, the BRP2 side rails are removable, allowing for a more ergonomic patient egress and provide extra space and comfort for patients with wider girth in their lower extremities. To remove the side rail, pull the pin located on the underneath side of the bed and lift the rail straight up. The pin remains attached to the bed frame, making it easy to find when it comes time for the care provider to return the side rail to the bed. In addition to being removable, the side rails can be placed in 3 different positions: upright, 45 degrees, and down. When side rail is in the upright position, the patient can use the rail to assist care provider in repositioning or turning. At 45 degrees, the side rail can provide stability and support to the patient during the ambulation process. With the foot side rail removed or in the down position, patients have a wider area to ambulate off the side of the bed. The low deck height allows the patient to sit on the edge of the bed and with their knees at a 90-degree angle. Patients are able to fully plant their feet underneath their body and reduce the risk of injury or injury to a care provider during the ambulation process. With the head side rail locked in place at 45 degrees to provide stability and support for the patient, the bed-up function on the platform can be used to raise the patient into a standing position. As the bed is elevated, the weight of the patient is gradually shifting onto their feet while keeping the patient in a safe and secure position on the bed until they are able to build up enough strength in their legs to fully stand on their own. Should the patient become unstable or feel lightheaded, they have the ability to sit back down onto the bed, reducing the risk of falling, injuring themselves, or their care provider. A size-wise walker can be placed directly in front of the patient for them to transition to once they are able to reach a standing position and ready to take the first steps. When working with patients, always follow facility protocol for safe patient handling. The BRP2 is equipped with Sizewise's multifunctional Rest Secure system, which incorporates a patient monitoring bed exit alarm system, scale, and protocol timer. The RSS is customizable to meet the individual needs of the patient and care providers, providing for greater efficiency, safety, and comfort. The patient monitoring bed exit alarm system on the RSS alerts the care provider that a patient is attempting to exit the bed or is in an immediate risk for falling in settings where continuous surveillance of the patient is not feasible. There are 3 alarm sensitivity settings and 5 different audible alarm tones that can be utilized. Additionally, the RSS features a voice alarm capability, allowing a family member or a nurse to record a message for patients so that they are not startled by the tones of the bed exit alarm. If connected, the nurse call interface on the RSS will notify the nurse's station when the alarm is triggered. The integrated scale on the RSS helps reduce the risk of care provider or patient injury by allowing care providers to accurately record the weight of the patient without having to transport or move the patient each time a weight reading is needed. The RSS records the patient's weight automatically at midnight, storing the most recent 30 readings in history. The RSS protocol timer can be utilized to alert the care provider that the patient needs to be attended to or checked on at intervals of 1, 2, or 4 hours. The protocol timer has the capability to alert care providers by an audible tone on the unit, and if connected to the nurse call interface, can activate the nurse call signal. For a more in-depth review of the Rest Secure system and its capabilities, please consult the Rest Secure system video found online at sizewise.net or contact your local Sizewise representative. Transportation of any patient can be a challenge for care providers. However, transporting the bariatric patient presents an even greater challenge. To assist care providers with transporting patients and reduce the risk of back strain or another type of injury, a power drive system can be equipped on the BRP2. Located on the headboard, the one-handed joystick control will not interfere with care providers' ability to intubate patients and allows for easy removal of the headboard in emergency code situations. Bed direction and movement is controlled by the joystick. As well, the power button, speed adjustment knob, LED battery power indicators, and warning horn are located on the joystick control. Before engaging the power drive, lower the bed to its lowest position, allowing the two drive wheels to touch the ground. The two drive wheels on the BRP2 help make navigation on carpet and inclines effortless, providing greater stability and weight distribution. Unlock the steer and brake pedals at the head and foot end of the bed. Unplug the bed and any support equipment being utilized with the patient from the wall. As a safety feature, if the bed is plugged in and the power drive is activated, the bed will not move. Once the BRP2 and patient are prepared for transport, press the power button found on the joystick control. The LED indicators notify care providers of how much charge the batteries have when the joystick control is powered on. Before engaging the power drive, ensure the speed is set to an appropriate level for the care provider. To set the speed, adjust the speed knob accordingly. Slow speed is indicated by the smaller marks on the knob, and faster speed is indicated by the larger marks on the knob. When operating the power drive, the care provider should be standing behind the headboard section of the bed. As the joystick is activated, the bed will gradually start to ensure the safety of the patient and care provider, working up to the selected speed. Care providers do not have to actively push the patient, they can simply steer in the direction of travel. To increase or decrease the drive while the bed is in motion, an adjustment to the speed knob can be made. The power drive is ideal for tight spaces and maneuverability, as it allows the BRP2 to spin 360 degrees while remaining in the same spot. To move the bed in reverse, press the joystick back. Care providers should take extra care when operating the BRP2 in reverse, always being aware of what is behind them as they steer the bed. When the BRP2 is equipped with the optional power drive system, it is important to remember to have the weight of the bed off the power drive wheels to ensure an accurate weight reading can occur. An emergency battery backup is available as an option on the BRP2. Should the bed not be equipped with the emergency battery backup, a manual hand crank is standard on the BRP2. The manual crank allows care providers the ability to operate the basic motor functions of the bed in case of a power outage or power drive battery failure. The manual crank is located under the foot end of the bed. The BRP2 frame is equipped with roller bumpers on each of the corners of the bed to protect walls and fixtures as the bed is transported throughout the facility. The BRP2 is equipped with 8 drainage bag hooks along the underside of the bed. The BRP2 offers care providers 4 accessory attachment points on the bed for items like an IV pole and O2 holder. The attachment points are located at the 4 corners of the bed, 2 at the head and 2 at the foot. To assist care providers in the rehabilitation of their patients, the BRP2 will accept a full-frame trapeze, making it ideal for the bariatric patient to take an active part in their treatment. An accessory bar located at the foot end of the bed allows for blowers like the Sizewise Big Turn to hang while remaining out of the way of the patient and easily accessible for care providers. The quick reference guide located in the literature pocket at the foot of the platform provides a reference for basic operational functions. For additional information on the BRP2, please consult the user manual or contact your Sizewise representative. Sizewise is proud to manufacture and assemble our products in the United States. Thank you for choosing Sizewise.